All right, team, let's review the data for today's case. The patient has a 2 centimeter swelling in the gum near the upper right front teeth. We will discuss the clinical procedures necessary to address this, including diagnostic imaging and potential surgical intervention. These steps are crucial for accurate diagnosis and effective treatment.
We should start with a comprehensive clinical evaluation, which includes patient examination and diagnostic tests like percussion, palpation, and radiographic imaging to identify the underlying issue.
Exactly. The clinical exam revealed a buccal sinus tract between teeth upper right lateral and central. The radiographs showed a radiolucent area around the root of upper right lateral, indicating a potential failure in the previous root canal treatment. What does this suggest to you?
It suggests that there may be a persistent infection or chronic apical abscess at the root of upper right lateral, likely due to leakage or insufficient sealing of the previous root canal filling.
Correct. Now, considering this diagnosis, let's outline the clinical treatment plan.
First, we will perform a non-surgical retreatment of the root canal on the upper right lateral. This involves removing the old filling material, cleaning and disinfecting the canal. Next, we will refill the canal with new material and seal it properly. If the retreatment fails, we will consider surgical options. In extreme cases, extraction might be necessary.
That's the comprehensive treatment plan. Let's go over the retreatment procedure in detail.
First, we will need to remove the existing root canal filling material using specialized tools.
What's the best way to do this?
We should use Gates Glidden burrs and ultrasonic tips under the operating microscope to carefully remove the old filling material and access the canal system.
Good. Once the old material is removed, how do we proceed?
We will clean and shape the canal, irrigating with sodium hypochlorite to ensure it's free from any debris or bacteria. Make sure to follow the irrigation technique closely. We will then use an apex locator to determine the correct working length before obturating the canal.
Remember, proper irrigation is crucial for disinfection. Practice this step to ensure thorough cleaning. Effective irrigation helps in removing any remaining debris and bacteria from the canal. After cleaning, what's the final step?
We obturate the canal using gutta percha and a suitable sealer. Then restore the tooth with a temporary filling until we can confirm the healing at the follow-up appointment. Observe the obturation technique closely. The gutta percha and sealer ensure a tight seal, preventing any future infections.
Correct. Let's discuss the follow-up clinical procedures and final steps to ensure patient recovery and treatment success.
We should schedule a follow-up in 3 months to take another periapical radiograph and assess the healing progress.
If the healing is favorable, we can plan for the final restoration, typically a permanent crown, at the 6-month follow-up.